Do you have a family member or a loved one who is suffering from an incurable disease such as multiple sclerosis, Alzheimer's, or AIDS? Are you willing to go the distance to alleviate or even eliminate their symptoms? One option you may have considered is stem cell therapy. According to an article by Rita Rubin, there are over 700 clinics in the United States that deal with stem cell therapies. This may be a good news, but how do we know if we can trust these clinics? Are they ethical? Are they FDA approved? In this segment, we will be focusing on one particular stem cell clinic located in New York City, the Park Avenue Stem Cell Treatment Center.
We researched the procedures offered by Park Avenue Stem Cells and determined whether they are compliant with the regulations set by the FDA. Furthermore, we took a close, in-depth look at the man behind the clinic, Dr. Joel Singer, a board-certified plastic surgeon and a supposed leader in the world of stem cell therapy. According to a YouTube video uploaded by Park Avenue, the procedures used by this clinic are straightforward. They perpetuate the idea that the procedures are simple and effective in their social media presence on Facebook, Twitter, and Instagram. First, fat cells, which presumably contain the stem cells, are extracted from the patient through liposuction. Next, the fat cells are processed into stem cells through a process called stromal vascular fraction, or SVF. Finally, the processed stem cells are transplanted back into the patient in an area predetermined by the doctor. In Paul Knopfler's book, Stem Cells: An Insider's Guide, the process of SVF is described as a process where extracted fat cells are treated with an enzyme called collagenase that breaks apart tissues to dissociate the fat. The fat is then centrifuged into fractions based on density. The top, least dense fraction is fat, which is thrown away. Then there is a fraction made up of fluid and perhaps some blood plasma, which is also discarded. The bottom of the tub is a pellet of cells and other elements called the SVF, which contains the mesenchymal stem cells. This process may seem simple, but there's a catch. Stem cell therapies, as with most human cell-based products, are regulated by the FDA. In the case of stem cell therapies, they are separated into two unique categories: 351 products and 361 products. A 351 is a biological drug that is subjected to pre-market approval by the FDA. In contrast, a 361 is a biological drug that is not subjected to pre-market approval by the FDA. A list of criteria is used to determine which drugs fall into these categories. One of the most important criteria is the minimal manipulation rule. According to a FDA report published on April 1, 2018, minimal manipulation means processing that does not alter the relevant biological characteristics of cells or tissues. If a product is more than minimally manipulated, then it is automatically considered a 351. Park Avenue's usage of SVF to process their stem cells makes them a 351, and are thus subject to FDA regulation. In SVF, the solid fat cells are digested into liquid fat cells using an enzyme called collagenase. Exposing the fat cells to this enzyme alters the biological characteristics of the fat cells. Even though this stem cell clinic is clearly supposed to be under FDA regulation, there is no mention of such regulation on their website. Knowing this information, one can conclude that what Park Avenue is doing is obviously unethical and not with FDA regulations. Dr. Singer is the leader of the Park Avenue Stem Cell Clinic and performs the treatment, consultation, and follow-up procedures himself. The Park Avenue website does a great job at establishing a good case for Dr. Singer and bolstering his credibility.
I have developed the capability to extract and produce 100 million stem cells in one sitting.
The website's info page about Dr. Singer cites his formal education from the Yale School of Medicine, as well as his affiliation with the Cell Surgical Network, an international organization of physicians devoted to clinical research of the benefits of adipose-derived stem cells. Hearing this, one would surely feel at ease with Dr. Singer as their caretaker. However, there are several negative aspects about Dr. Singer that the website does not tell you. We briefly mentioned at the beginning of this segment that Dr. Singer was a plastic surgeon. Unfortunately, Dr. Singer's past work as a plastic surgeon had been plagued with several disputes with the New York State Medical Examining Board. A simple Google search of the doctor's name will reveal a 2015 article by the Connecticut Health Eye Team about how he was placed on medical probation and fined $10,000 due to his connection with a botched 2019 plastic surgery procedure. Further digging will reveal a 2012 document by the Connecticut General Assembly where Dr. Joel Singer was fined $29,000 due to numerous violations of infection control and instrument sterilization procedures at his Westport clinic, as well as gaps in medical records and surgery logs. The document also notes that some of the nurses present at this clinic lacked the proper medical experience. Dr. Singer's affiliation with the Cell Surgical Network is also quite troubling. According to a short article by Dr. Paul Knopfler, the Cell Surgical Network was recently targeted in a lawsuit due to its connection in a botched stem cell treatment that caused a patient to lose vision. These alarming revelations about Dr. Singer's history heavily affect his credibility. A doctor who has such a troubled past and affiliates himself with potentially unethical organizations cannot be fully trusted.
Our investigation into Park Avenue exposed us to how these stem cell treatments are actually conducted and the doctor behind its operations. In the next segment, you will hear about how safe and effective these treatments really are.
If patients still express interest in seeking treatment from Park Avenue, would it be worth their time and resources? Do these treatments actually work? And what risks are associated with receiving these treatments? Unfortunately, answers are inconclusive. In the FAQ section of Park Avenue's website, the question of what claims can be made by Park Avenue on treatment effectiveness is raised, to which their reply is none. Our aim is to make cell-based medicine available to patients who are interested and to provide ongoing research data. And they later state, most likely, no claims need to be made. Rather, a statistical analysis of our findings would suffice to suggest whether treatments are truly and significantly effective. Patients are essentially being utilized as guinea pigs for treatments that are not claimed to be effective. Park Avenue's argument against having substantiated claims is that cells are the patient's own and therefore cannot be considered medicine. This is troublesome because, as we saw before, these cells should be considered medicinal because they are more than minimally manipulated in their creation process. It is incredibly irresponsible to allow patients to receive treatment, even by their own choice, when evidence of its effectiveness is inconclusive. Furthermore, some of the reported potential risks of these stem cell treatments are misleading or downright inaccurate. One large area of concern is that Park Avenue reports their adult mesenchymal stem cells are not known to cause cancer, but numerous peer-reviewed articles say otherwise, including a study led by Hwang-Young Lee of Jungwon University in Korea that states, several studies have observed potential adverse effect of mesenchymal stem cells, including tumor growth, metastasis, and transformation into cancer cells. Now, if, despite these risks, patients do decide to seek treatment from the Park Avenue Stem Cell Treatment Center, how much might it cost them? We called the clinic to get an estimate of this amount, but unfortunately the answer was unclear, as you will hear in this short clip of a conversation we had with the receptionist at Park Avenue.
Hello?
Good afternoon, Park Avenue Stem Cell.
Hi, I was wondering if I could talk to you guys a little bit about getting some stem cell treatment for my mom who has MS. How much will this cost? Can you ballpark what previous MS treatments have been like for other patients?
It's all case by case. That you'll have to come in with your mom, and she can talk to her about her condition, when it started, what treatment she's on, and everything that's going on. And that's when he does the determination. They could never be done by phone because they're case by case.
The answer is inconclusive as they claim to only know how much a treatment would cost ever consulting with the patient in person. We were not even able to get a range of estimates. The receptionist was very adamant that costs are only discussed after a consultation, which could be a huge roadblock for patients that desperately want and or need treatment, but come to realize they cannot afford it.
The unethical practices of Park Avenue Stem Cell, such as false descriptions of the treatment's effectiveness, are not limited to this singular clinic. We mentioned earlier that there are over 700 clinics in the United States alone, many of which are not compliant with the FDA's regulations. If you or a loved one are thinking about stem cell therapy, it would be wise to do extensive research before scheduling any consultations.